Life is so amazing that fortuitousness reigns all, and that's the case for me today. I'm so privileged. Dr. Sheila Kilbane is with me today, and this is just one of those remarkable experiences of serendipity. So, Dr. Kilbane is a pediatrician, expert in the holistic integrative functional medicine application to kids' health problems. And I'm Jeff Bland, just sitting here in my offices in Bainbridge with my colleagues. And lo and behold, here is Dr. Kilbane visiting her parents that happen to live in Bainbridge Island. So we just connect by Facebook. Now, what can I say? It worked. So thank you.
Oh my gosh, I'm completely starstruck, and I have a permagrin because when we connected yesterday, I was like jumping for joy, going, "Oh my gosh, I might meet Jeffrey Bland. I might meet Jeffrey Bland." So this is a huge honor, and I have studied your work, and you have brought into you have given so many of us the ability to help so many patients, and I mean forever. I'm gonna not say too much because I will start crying. But seriously, the professional satisfaction that I started to get back from medicine after being able to practice this way was unparalleled, and you just get this confidence no matter what is going on with the patient, that you know you're going to be able to really figure it out. And of course that's not 100% of the time, but my confidence in the more difficult cases, it skyrockets when you're practicing functional and integrative medicine.
Wow. I think this is why I've hung out in this domain for the last 4 decades. So thank you, just to meet you. So we were talking earlier, and I know there's so much we could talk about, but because we're doing Facebook Live, we probably need to do this quickly. So let's just talk about asthma just for a second, because I know that's a very significant problem in the pediatric world. It's growing in frequency. I talked to a good friend of mine who's a fire chief that said that since he's been doing EMT work and going to schools, that it used to be just a few EpiPens were in the schools. Now he goes and there's a whole board with all these kids that their parents have these medications for them to help with these anaphylactic reactions. So tell us about your experience with the asthma child.
Yeah, so asthma has become, and it sounds odd, but one of my favorite things to work with patients, because we typically see such a transformation. And I'll just use one little fella as an example in my practice, who we started seeing actually at the end of last summer. And many hospitalizations. Every time he would have an asthma attack, he would end up in the ER and then often be in the hospital for several days. And so what we did is we look at the microbiome. We use something called the urine organic acid test, and we do blood work, just pretty standard blood work. And then we start to optimize the child's digestion. We make sure they have adequate magnesium, adequate vitamin D, and then we kind of tailor the other supplements based on our testing. And the kids, once you give their cells what they need, and I always talk about it as, we want to make sure we have really healthy cell walls so that the nutrients can flow in and out. We want nice cell walls so that when we get cell breakdown, which we always have, we either get a neutralization or a decrease in inflammation, versus all of the foods and the processed foods, which make really unhealthy cell walls and kind of rigid cell walls, where we get an increase in inflammation. If we just simply make sure that we have that child's physiology and cellular health working properly and their digestion working properly, we see significant improvements in these inflammatory conditions. And it's like this young boy in particular, I was so happy when COVID hit that we had all of those months beforehand to get him all teed up so that he would do well. And he's just, he's one in many patients that I've seen over the years. And whether it's eczema, recurrent ear infections, chronic constipation, or loose stools, like the mouth breathing, storing. I always call it the Darth Vader breathing. And these kids have dark circles under their eyes. They have bumps under the back of their arms or their cheeks. You and I can see them a mile away. And it's often all I can do not to say to the family, do you know there's something we can do about that? So it's really with the tools of functional medicine. It's really I have an incredible integrative pharmacist who works in my practice, Deb Allen, and a naturopathic doctor, and we talk about cellular health all the time. And we sometimes when Deb and I do talks, we'll put up there's a little clip about high school biology from cell biology. Schoolhouse Rocks, maybe.
Oh yeah.
It's one where he gets up on
Yeah.
he gets up on the desk and starts singing, and it's because it's not about. I think people think about functional and integrative medicine that it's kind of frou-frou, but it's really biochemistry. And how I would love for you, because we're doing the Facebook Live on my page also, and I would love for you just to give us a little bit of how what I mean, truly you're a pioneer in this field, and what led you into this?
Well, real quickly, I think what led me was I had this extraordinary opportunity to take a sabbatical 2 years with Linus Pauling at in Stanford in Palo Alto, and that was a life transformation. I was 40 years old at the time. This was 82, 84, and it just really opened up my world to the opportunities to be a little bit more assertive about what I thought and where I wanted to go, and not be just held in by the academic constraints of normal, usual, and customary thinking. And it gave me permission to be a little bit more of an explorer. And it also gave me some tools, because we had the chance to meet, there were all these world leaders coming in and visiting Dr. Pauling. So when I came out of there, and then I met Dr. David Jones at a medical meeting, and we both just got put next to one another. And he was starting his practice in Ashland, Oregon, as a young physician, and I was still a young professor in the medical school. And so we kind of just collaborated, sitting there together, and we eventually said, we could run a better meeting than this one. And then we said, we're going to form our own organization. Well, it turned out that what happened was I became the president of that organization, Northwest Academy of Preventive Medicine. He then started the Southern Oregon Academy of Preventive Medicine. We collaborated for 10 years, and then eventually out of that in 1991 was born the Institute for Functional Medicine with my wife, Susan. So that was kind of the whole, giving me the permission just to freewheel and not be feeling so constrained into the usual and customary.
Yeah, very good. Oh my
So I want to, given the sake of the shortness of these videos, just to thank you, Dr. Kilbane, for reaching out and coming over. And I think this is going to be the first of many. But it reminds me, this is really why I started doing this 40 years ago. Quite honestly, it's meeting people like you, seeing your advocacy, what you're doing with your patients. In the end, it's the proof of the pudding is the outcome. And when you see patients that have been for in years, children through geriatrics that have been laboring, that you can unleash their potential health, it makes everything worthwhile.
Yeah, it's hands down. That is, it's why we got into this, right?
It is.
Yep.
So thank you.
Thank you. I appreciate it very much. All right.
Thank all of you.